Glyphosate, unveiling its comprehensive impact on health and environment. Introduction. Glyphosate, the active ingredient in many herbicides, notably Roundup, is the most widely used herbicide globally. While it has been praised for its effectiveness in weed control, increasing evidence highlights significant concerns regarding its impact on human health and the environment. Environmental impact of glyphosate. Persistence in soil and water. Glyphosate was initially believed to degrade rapidly in the environment. However, studies have shown that it can persist in soil and water systems, leading to potential ecological consequences. pmc.ncbi.nlm.nlm.gov. Key findings: soil health. Glyphosate residues can remain in the soil for extended periods, potentially affecting soil microbial communities and nutrient cycling. Water contamination. Runoff from agricultural fields can introduce glyphosate into waterways, posing risks to aquatic ecosystems. Effects on biodiversity. The extensive use of glyphosate-based herbicides has been linked to declines in biodiversity. Key observations: plant diversity. Glyphosate application can reduce plant diversity, leading to habitats dominated by a few resistant species. Wildlife impact. The reduction in plant diversity can have cascading effects on insects, birds, and other wildlife that depend on a variety of plants for food and habitat. Human health concerns. Neurotoxicity. Emerging research indicates that glyphosate may have neurotoxic effects. Key points: oxidative stress. Glyphosate exposure has been associated with increased oxidative stress in neural tissues. Neuroinflammation. Studies suggest that glyphosate can induce neuroinflammation, which is linked to various neurological disorders. Liver and kidney damage. There is evidence suggesting that glyphosate may adversely affect liver and kidney function. Findings: liver inflammation. Research from the UC Berkeley School of Public Health found that childhood exposure to glyphosate is linked to liver inflammation and metabolic disorders in early adulthood. Kidney damage. Some studies have reported potential links between glyphosate exposure and kidney damage, though more research is needed to establish a definitive connection. Regulatory and legal developments. Legal cases and settlements. Glyphosate has been the subject of numerous legal battles concerning its safety. Notable cases: Australia. A major class action lawsuit involving over 800 individuals claimed that glyphosate-based herbicides caused non-Hodgkin lymphoma. The federal court ruled in favor of the herbicide manufacturer, citing insufficient evidence to prove causation. United States Bayer AG, the parent company of Monsanto, has faced multiple lawsuits alleging that Roundup causes cancer. In a significant development, a U.S. appeals court ruled in favor of Bayer, stating that federal laws preempt state laws regarding warning labels, thereby shielding the company from liability. Regulatory assessments. Regulatory agencies worldwide have conducted assessments of glyphosate safety. Key assessments: U.S. Environmental Protection Agency, EPA. The EPA has stated that glyphosate is not likely to be carcinogenic to humans when used according to label directions. International Agency for Research on Cancer, IRC. In contrast, the IRC classified glyphosate as probably carcinogenic to humans in 2015, highlighting the ongoing debate within the scientific community. Alternatives and future directions. Mechanical weed control. Innovations in agricultural technology are providing alternatives to chemical herbicides. Example: robotic weed control. Companies are developing robots capable of identifying and removing weeds without the need for herbicides, offering a potential solution to reduce glyphosate dependence. Integrated Pest Management, IPM. IPM strategies combine biological, cultural, physical, and chemical tools to manage pests sustainably. Approach: crop rotation. Alternating crops can disrupt weed life cycles. Cover crops. Planting cover crops can suppress weed growth and improve soil health. Conclusion: while glyphosate has played a significant role in modern agriculture, its potential environmental and health impacts necessitate a re-evaluation of its widespread use. Exploring alternative weed management strategies and conducting further research are essential steps toward ensuring both agricultural productivity and ecological integrity. Disclaimer: this article is for informational purposes only and does not constitute medical or legal advice. Consult appropriate professionals for guidance specific to your situation.